Thank you for joining me, Dr. Amir, here at Fortis Health for another insightful session on the topic of testosterone replacement therapy. The question about route of administration of testosterone. So there's several routes that one can administer testosterone rather. The first route is the oral route. Now we don't use that much and it has two parts to it, what we call the enteral route. So we've got obviously the oral administration or the sublingual or the buccal. Now we don't use that too frequently, obviously because it's a couple of reasons. Firstly, you're having to take it regularly every day, and also we want to try to bypass the liver having any, if you want, any need to want to manage an extra chemical inside your body. Whenever you take anything orally, your liver has to go, or the medication goes through a process known as first pass metabolism. There's also a second pass metabolism, but first pass metabolism, most things go through your liver, basically has to deal with the drug, deal with like things like hydrolysis and conjugation, and that can put pressure on the liver. Now, if we can reduce that effect, that's better for us. So in our clinic, we use what's called parental, which is basically anything outside of that area. So being either through the muscle or through the skin or through the subcutaneous fat. So the muscle will be an intramuscular injection. We choose to use the sites along the leg, sometimes the deltoid, very rarely the glute if you have someone helping apply it for you. So that's the intramuscular route, which means going into the muscle, a deep injection. Some people complain about it being quite painful. Actually, we use really small gauge needles, 25 to 27 gauge needles. Are really, really thin. There's the subcutaneous route, a slightly more innovative route came about in the last few years, where you can actually use certain testosterones and apply them into the skin, under the skin rather, into the dermis, into the subcutaneous fat, like you do with an insulin injection in the abdomen. And that can be something feasible as well. So people like using that as well. Again, they've both got benefits and some cons to it. And then finally, you've got the topical application, which some patients like as well, where you have to apply the gel or the cream every day, regularly, 1 or 2 applications a day. Again, pros and cons to that. Compliance is the main one because you've got to maintain using it every single day without failure. Some people are very good. They've got very good regime protocols, like, brushing teeth and combing hair, what have you, and they keep it in that same kind of algorithm where they give it to themselves every day. Injectables, because they're given out maybe once, twice, sometimes 3 times a week, they're slightly more, from a compliant point of view, easier to administer. Some injections, actually, we've had patients on 1 injection every 7 to 10, sometimes every 14 days. So it depends on the patient. It depends on their preference. Are they needlephobic? Are they not needlephobic? Are they happy to inject? Are they not too keen on injecting the muscle, injecting into the leg? Or if obviously they are needlephobic, then they can use topical rubs instead. And those are the ones that we actually we prefer to use. But yes, we do also have access to enteral route medications, so oral, buccal, or sublingual.